This year's Nurses Day theme is Nurses, a Force for Change, Cost Effective, Care Effective. Do you know what this exactly means?
To understand this, let us try to define it. Cost effectiveness and care effectiveness. We often hear of nurses as being cost effective and care effective. Understanding of these terms is vital in guiding decision-making for optimum use of resources. Cost-effectiveness analysis enables decision-makers to quantify health benefits in terms of health rather than in monetary terms. It is used to determine which intervention achieves a specific outcome with less cost by comparing two or more healthcare interventions. For example, a cost-effectiveness analysis can be done to compare immunizations given by physicians with those given by nurses to determine which group achieves better outcomes with less cost. Another example can be comparing two drugs for hypertension to determine which drug produces desired outcome at less cost. The interventions are compared in terms of their costs and of their health outcomes or health benefits.
So, the intention is to achieve healthcare outcomes with fewer resources. Is that correct?
Yes, which leads us to a related concept of care effectiveness, which means care that is based on scientific evidence and produces the intended results or outcomes. In reference to nurses, care effectiveness is the extent to which health problems are solved and the degree to which outcomes are achieved. If we add cost effectiveness to this definition, it means nurses achieve the intended health outcomes at less cost, with quality as an underpinning element. The cost of healthcare is rising worldwide, largely driven by the heavy and growing burden of non-communicable diseases, including mental health disorders, aging societies, innovation of expensive treatments and techniques, and increasing demands of clients. The rising cost of healthcare is placing a heavy financial burden on health systems and populations globally.
Well, equity in access to health services is the need of the hour, so that those who need the services should get them, not only those who can pay for them.
So, we have to focus on the poor and efficient use of resources.
So there is a reason for Nurses, a Force for Change, Cost Effective, Care Effective being the theme for this year's Nurses Day.
Yes, we have this theme because of some major inefficiency in healthcare sector, which needs to be looked at and rectified. The major source of inefficiency in health systems include overuse of brand name medicines and underuse of generic products, use of substandard and counterfeit medicines, overuse of supply and equipment, investigations and procedures, inappropriate or costly staff mix, unmotivated workers, inappropriate hospital admissions and length of stay, medical errors and poor quality of care, waste, corruption and fraud, inefficient mix of inappropriate level of strategies such as funding high cost, low effective interventions when low cost and high impact options are unfunded.
We also need to ensure no medical errors, hospital-acquired infections, and pressure sores happen, which results in increasing hospital stays and cost of health care. So, what can nurses do to improve health system efficiency?
Nurses can do a lot to improve healthcare efficiency. Nurses should ensure better prescription and guidance. Nurses should educate patients on counterfeit medicines. Nurses should adhere to infection control procedures. Nurses should impart knowledge about the common risk factors for non-communicable chronic diseases like tobacco use, physical inactivity, harmful use of alcohol, and unhealthy diets. Nurses should use effective communication. Effective communication is a cornerstone of patient safety and quality of healthcare. Nurses should pool problems, sharing solutions. Nurses are in an ideal position to identify and address problems that can contribute to the development of a more care-effective and cost-effective system. Nurses must use supplies and equipment effectively and should be aware of how much supplies cost and how waste occurs. For example, wearing gloves while making beds is wasteful, and this may lead to shortage when gloves are needed most, such as when changing wound dressings or other procedures requiring a high degree of infection control. Nurses should be able to manage multiple prescriptions. A significant number of patients often take multiple prescription drugs because seeing multiple doctors and may get conflicting medical advice and prescriptions. Hence, nurses should know how to manage this.
Oh, that's so much nurses can do to improve health system efficiency.
Well, that's not all of it. They can contribute so much to improving mental health, improving patients' functioning, reducing cardiac morbidity, reducing domestic violence, planned pregnancy, positive mental well-being, nurse effectiveness in HIV/AIDS care, reducing viral load, embracing technology to deliver cost-effective care, reducing length of stay, reaching rural communities, community health and development, extending coverage, substance abuse, stopping smoking and addressing alcohol use, nurse effectiveness related to staffing and educational level of nurses, reducing death, pain and suffering, better resource usage, and in-school health services.
So now you know, as nurses, how big a force of change you are in providing cost effectiveness and care effectiveness to our health system, which exactly is our theme for Nurses Day 2015.